Over to you, ma'am.
So thank you all for coming to this session. This is a specific session that Dr. Banshi sir, Dr. Amit, and the entire team of Diabetes India has dedicated to diabetes and women. And the interest group was invited to sort of give topics. If you noticed, of course, women's health is all pervasive, but we have selected just a few, topics to highlight, and you will see why they were highlighted this morning. So I think we had an excellent lineup of speakers thus far. I'm very grateful to all of them on behalf of the interest group and my co-chair, Dr. Rutul Goklani, as well, that they took the effort to be here and speak on these very important topics that are seldom highlighted in different conferences. So here I am going to speak to you about a potential collaboration that this group is thinking about. A very powerful one if we can manage to do this, and the discussions are on. We would require coordinators from all over the country, different states, to actually help us get this going. Uh, we do have examples from the Western world where they've done, 40, 50,000 studies, track their health for maybe, 10, 15, 20 years as well. The nurses study and then the physician study in the male population, so on and so forth. So this has never been undertaken in India, and I think it's time. We have recognized the differences between uh, women and men biologically and as well as with respect to disease manifestation, treatment responses, and so on and so forth. And I think we are just in the correct time frame to actually undertake this endeavor. So, yes, in a dream world, healthcare professionals will all adopt a life course approach to diabetes care in women with attention to adolescent, pregnancy history, hormonal imbalances, cardiovascular risk, so on and so forth. Of course, we would also have all the policymakers with full attention and focus on women-centered diabetes services. I won't say we're doing that bad a job, but we are not where we should be. Including prematernal counseling, pre-pregnancy care, gestational diabetes follow-up, and prevention strategies as well. Researchers and funding bodies, where they can prioritize sex and gender specific research in diabetes. And there's absolutely no denying the fact that women initially they were not included in clinical trials or research endeavors simply because it was somewhere understood that they cannot be given new drugs because because of the childbearing potential and potential harm to them, but at the same time, later on, when they were included, again, there was not an equal number, just a small, sizable population of the entire clinical research endeavor. And and we would still extend all the findings from the males in the trial results to applying them to women. And this is actually one of the fundamental reasons why we also have more adverse drug reactions in women than men. So we have never really studied them to the extent that we need to study them. And of course, we want that everyone, like the diabetes and women's interest group, should pitch in. They should advocate for raising awareness of diabetes as a critical women's health issue. So this is in a dream world. We are somewhere making great progress and walking in strides, and somewhere we are not. But we are definitely recognizing more and more that gender-specific biology and hormonal influence are important across all stages of a woman's life cycle. There are also social determinants and cultural context which is critical in our consideration for what care we can offer women. The mental health and stigma against diabetes, obesity, and other metabolic disorders also impact the outcomes. Intergenerational impact of diabetes in women is equally important to keep in mind, and the need for life course based and women centered diabetes care is paramount. With that, let me just take you back. So, this is all what we do for women in general, but what do we do for ourselves? And this is often a question asked but never really taken into detailed consideration. There was an IMA, the Indian Medical Association initiated physician study a few years ago where they looked at physician burnout and stress, violence against doctors, and among lifestyle diseases. Uh, they didn't even track that, but the incidence or prevalence of diabetes and hypertension were abnormally high in physicians across India. But that was only a questionnaire based study, and it's now time to move on from those particular hints where women didn't even participate fully. I think it's really time to move on to a specific endeavor. So the IDEC team and the IDEC group, which is led by Dr. Sanjay Agrawal, Dr. Neeta Deshpande, and the entire team, is a fantastic team. And one of the sessions at their annual congresses, this idea came up, and we decided to take this forward. And from the diabetes, it's all about coming together. So even though it is conceptualized there or it was thought of at their annual congress, the diabetes and women's group can easily collaborate with them, and that would be a great opportunity for us. We would also have a say in the protocol development for the same, along with other experts in the field. And this would include all women physicians across the country, every state, and we can even take it further based on different collaborations we can have. I just saw a few people from the IDF also attending this session, and I thought it was very encouraging. As for myself, I have been inducted into the IDF Diabetes and Women's Group as well. So I will definitely run this across with them as well if they would like to participate from other countries in the same. The entire project and protocol will be submitted to an institutional review board or a central ethics committee for approval, and informed consent will be taken from every physician. So the plan is that it will be conducted as a prospective study to determine women physicians' health over 5 years. To begin with, it can always be extended. But remember, we in the dream world we wanted the funding agencies and grants for such projects. So we're limited by that at the moment. After informed consent, the demographic data will be collected in an anonymized manner at baseline, of course, which will include simple aspects of age, gender. We know this is only for women physicians. And of course, we will also, understand what kind of socio-economic background they come from, and because just to understand, how are we faring and how is it all going about. We will encourage self-data entry for the same, because to again run a project of this sort of quantum of this magnitude is going to be very difficult. We do not have CROs and sponsors stepping in so that they can take care of the entire data capture, data analysis, and reporting. So a lot of this will be done by ourselves. Baseline medical and surgical history will be captured, wherein we'll see if they already know they have diabetes, hypertension, obesity, overweight, or other cardiovascular aspects as well, or any other comorbidity that they like to share. Anthropometric measurements will be mandatory and which have to be entered. Weight, height, waist circumference, hip circumference, and we also plan to include neck and calf circumference as well. There will be basic tests required. This will have to be done by themselves because we absolutely do not have the bandwidth to actually fund any of this. And they are women physicians. We encourage them to undertake those tests at least on an annual basis, and if required, more often than that. So there will be baseline assessments requested. We'll see how many fields are filled up and how many remain blank, but we'll still request for the data. Additional tests and optional tests would be a sonography, of the abdomen pelvis, and also DEXA to look at the bone health as well, and body composition analysis wherever available. But what we plan to do is send or share certain reminders on dietary recommendations as well as physical activity from the group themselves, so that while tracking their health, not offering any active intervention, they could be taking whatever medications as per their own discretion or their follow-up with their physician. uh, we will only be offering certain tips on behavioral changes, say like, did you sleep well today, or have you been drinking enough water, etc. Some small tips like that. But that will definitely change. Data collection and analysis will be done on an annual basis within India itself. So, if you repeat tests, more often than that, you just keep plugging it in. But all this data will be collected at the end of one. I mean, it will be there in the system, but it will be looked at or analyzed only after 1 year of follow-up. And so this is the initial plan. Of course, inputs are always welcome. And as we roll out, we will come across operational challenges as well. And we would love, voluntary, and that's not just limited to women. It is definitely open to men coming forward to help us in this project. And we can always talk about, what comes out of it and how we will have authorship on the same as well. So with that, I thank you very much, and particularly Dr. Banshi sir, Dr. Amit Gupta, and of course Dr. Arvind Sosale sir, as the President of Diabetes India, and the entire team for this very esteemed opportunity that they have, and the support and encouragement that they have been providing our group. So thank you very much. And I think the next is the book. Yeah. So I also wanted to share that our group has been doing maybe, not as many, but a few, but very, very thought provoking as well as very well thought out programs. We are on the verge of rolling out 2 or 3 projects further, which we will invite everybody on the Diabetes India group to participate. One is on female sexual dysfunction, another one is on PCOS and diabetes connection, and also we have already in the last year itself, we have Dr. Meenakshi Bajaj also in our core committee, and with her help, we have reached out to hundreds of dietitians, nutritionists across the country, and we've got really wonderful recipes for women on the go. So we want that our women should be, of course, they should accept all challenges in life and be, up to facing them really well. But we want to help them, face life and other responsibilities that they sort of go through in life. And of course, that's also taking care of all the men. That's a cultural thing for us in India. It doesn't mean that we expect them to do that. That's if they wish to. And that recipe book can be shared with everybody. It's not just, but it was particularly kept made with that in mind, that this is more for people on the go, so that even when you are rushing about and having a jet set hard work life, finding it difficult to maintain a work life balance, you still end up eating healthy. So that was our one of our endeavors, and we are going to publish. In fact, it's already compiled well, and we are going to publish with absolute acknowledgement to each and every nutritionist who came forward to do this, because it was a very exhaustive exercise, but it's really come up nicely. So again, I will look forward to support from all of you. We will be giving few copies around when it's ready, but we would love it if you all buy it as well. So that funds our next set of endeavors. Thank you so much.